Hi everyone, this video lecture is about cognitive behavioral therapy, and we'll be going over the philosophy and view of human nature, and then moving into the therapeutic process in the second video. So to begin, just a note about terminology. So in your text and perhaps in your practice, you will find that other forms of therapy that have a cognitive and or behavioral component may all refer to themselves as CBT. So rational and motive behavior therapy, cognitive therapy, and strengths-based CBT all fall under the general umbrella of cognitive behavioral therapies. And accordingly, they share many common traits, including being very directive, being focused on the present, and being empirically based. The difference between them lies primarily on what they emphasize the most. So, for example, Beck developed specific treatment protocols for each disorder with cognitive therapy, whereas Ellis, who does REBT, rational and motive behavior therapy, applies the same philosophical principles to all disorders, regardless of what it is the client is presenting with. Okay. So, philosophy and focus of treatment for CBT. CBT is an insight-focused therapy that has a very strong psychoeducational component. This means that it emphasizes identifying and changing negative thoughts or cognitions and maladaptive beliefs. The focus is on the current problem, not the roots of the problem. So this means that therapists do not focus therapy on the past, other than what they consider to be essential to understanding how and when a certain core dysfunctional belief originated, and how these ideas have a current impact on the client's difficulties or presenting problem. CBT also involves designing specific learning experiences to help clients understand the links between thoughts, behaviors, and emotions. Okay, so often this is shown in a triangle, and I'll show that a little bit later. This suggests that a client's negative thoughts create negative assumptions and core beliefs, which alter their feelings and behaviors. These thoughts can be identified through introspection, which involves thinking about mental or emotional processes. So through learning experiences, like empirically testing a belief system by looking for evidence for and against, for example, or by actively engaging in a dialogue with the therapist, by completing homework assignments, and other activities such as that, the client can begin to identify and restructure maladaptive cognition. The interventions that you'll see covered in the treatment process video will include both cognitive and behavioral or action-based interventions, and they do involve assessment and evaluation in this form of therapy. Basic assumptions. First, the way an individual interprets the events that they experience impacts how they respond to those events emotionally and behaviorally. So two different individuals can experience the same event, but the way it is interpreted or perceived will impact the way they feel about it and what they do about it. Treatment then attempts to identify and alter negative thoughts and perceptions. By turning them into positive thoughts, they can then have a positive impact on feelings and behavior in the opposite way that a negative thought was having. So this quote by Hamlet can be helpful. In essence, the school of therapy suggests that it's not the event that causes the mental health issue, but rather the meaning that we make out of it. This is why, as I said, the same event can impact different people in different ways. So as an example, consider failing a test, if that's the event. Okay? If you interpret the failure of this test as reinforcement of the belief that you're never going to pass, that will probably make you feel discouraged and will likely result in behavior like giving up, not trying, not studying, because you have perceived that this is just evidence that you're never going to pass. Alternatively, if you interpret this failing of a test as a challenge to work harder, this may make you feel motivated and driven, and you may change your behavior so that you study more, for example, and then you start to do better. Now, of course, the perception of the event is influenced by many factors, and we'll get to some of that a little bit later. Okay, so here's another example of how an event can be interpreted in multiple ways. So in this case, the same event was interpreted in two different ways. That event was a breakup. So in the first case, it was interpreted as I am no good, I am not worthy of a relationship, and it resulted in feelings of depression. In the other, it was interpreted in a more realistic and functional manner, stating we weren't a good match, and that resulted in no depression. I do want to note that just because the second person in this case did not experience depression, this doesn't necessarily mean that they didn't experience psychological distress, right? It would be normal to feel a little down or to isolate a little bit after a breakup, but it's not going to result in as significant of a mental health issue if it's interpreted in a more healthy and realistic manner, as opposed to using these dysfunctional or maladaptive belief systems. Okay, so that's the general overview of CBT. We're going to get more specific here with some key concepts. First, 3 levels of thought. So we're going to start at the top of this pyramid and work our way down. So automatic thoughts are those moment-to-moment unplanned thoughts that flow through your mind all day. So the I am never going to pass, for example, that we used in the failing a test example, would be an automatic thought. These automatic thoughts shape your perceptions, how you perceive things, how you make meaning of things. They determine your goals, what you're going to work toward versus what you're not going to work toward, and they provide meaning and interpretation to events. Okay? These automatic thoughts are generated from underlying assumptions, and underlying assumptions are rules or guiding principles that often include absolutes, so things like shoulds, musts, and if-then statements. For example, an underlying assumption may be, if I don't let my friends cheat off me, then I am not a good friend. And you can see how having that underlying assumption may create automatic thoughts like, my friends don't like me, in the event that you didn't let them cheat off of you. Okay. Now, the underlying assumptions come from core beliefs, and these are core beliefs about the self, others, and the world. For example, the core belief that the world is unsafe, which will, of course, move into creating certain underlying assumptions like I should never go outside, right? And certain automatic thoughts. That person just passed by my house, they must be wanting to harm me. So there'd be some examples. So the assumptions and beliefs are stable and usually outside of a patient's awareness, okay? Whereas the automatic thoughts are a bit easier to access because they do tend to be more conscious. So therapy attempts to identify these automatic thoughts that are negative and counteract their effects by using experiments, for example, to see how realistic are these thoughts, and then what can we replace them with. So here would be an example of these 3 levels of thought for depression. So a core belief of I am unlovable may yield underlying assumptions like, if people do not listen to me, it means they do not care. And that may yield automatic thoughts like, my father never listens to me when I talk to him, and therefore he doesn't care because I am unlovable. All right, next key concept is the cognitive triad. And this came from Beck, who recognized that regardless of the cause of depression, so whatever happened that led to the depression, once people became depressed, their thinking reflected a negative cognitive triad. And this involved negative views of the self, the world, and the future. So the negative views of the self could be considered things like self-criticism, okay, and statements like I am unlovable, I'm unworthy of a relationship, I'm a failure, things like that would all be negative views of the self. Negative views of the world could be thought of as pessimism, so interpreting life events through a negative filter. The world is out to get me, right? The world is hostile in this case. And then negative views of the future, basically a gloomy vision of the future, and feelings of hopelessness. So nothing will work out for me. I am destined to fail. Okay. Now, what's interesting about these is they're all bidirectional, meaning that they influence each other. The views of the self influence the views of the world, which influence the views of the future, and all the way around. And so even when a negative thought of the self, for example, was not the original cause of an episode of depression, while in their cycle of depression, folks who are depressed do tend to have these negative views of the self, world, and future. Okay. According to cognitive therapy, this triad is also present for various other mental health issues like anxiety, for example. The types of negativity will just be slightly different. Okay, Next, cognitive distortions. There are a whole bunch of cognitive distortions, and essentially what they are faulty information processing that can cause exaggerated emotional and behavioral reactions. Remember again that our thinking is directly connected to our emotions and our behaviors. So if you have exaggerated or incredibly negative thinking, it's going to have that same negative impact on your feelings and your behaviors. And so that's normally what we see in our clients. So with CBT, because we focus on changing beliefs and cognitions, we're going to focus on the cognitive content of a client's processing and a client's interpretation of events or experiences. And we're going to focus on trying to change those beliefs in order to change feelings and behaviors. If you change behavior without changing the belief, CBT therapists believe that this will inevitably lead to relapse because you're not changing the underlying filtering system, if you will. Okay, so let's go through these really quickly here. Dichotomous thinking, sometimes it's called that black and white thinking, where there's nothing in between. There's no gray area. This is the worst job I could possibly have. I hate it. It's the absolute worst job in the whole world. So that black and white thinking. Overgeneralizing involves holding an extreme belief on the basis of a single event and applying that belief inappropriately to dissimilar events or settings. So for example, my last relationship ended badly. I am destined to have horrible relationships for the rest of my life. Negative filtering involves focusing exclusively on the negative things that happen and seldom noticing the positives. Mom and dad always paid attention to you and never to me, which may be true, but perhaps is just a result of negative filtering where you're only seeing the negative. Someone who's really pessimistic all the time and just always sees the negative side in things would be someone who does a lot of negative filtering. Labeling, assigning negative traits to yourself and others based on imperfections and mistakes of the past. I'm a coward, I'm a loser, I'm lazy, and so on. And those things, after you keep telling them to yourself over and over in your head, you start to believe them, and they, of course, influence your feelings and your behavior negatively. If you believe that you're lazy, truly believe it, it's going to make you feel lazy and unmotivated, and your behavior is going to reflect that. You're going to stay in bed all day, for example. Okay. Here are some more. Fortune telling, predicting the future negatively, likely coming from a negative view of the world and the future. Okay, all of this studying won't help. I'm going to fail anyway. I'm not going to go out on this date. He's going to break my heart, something like that. Magnification or minimization involves either blowing things out of proportion in the case of magnification or making light of things that should be a big deal, minimization. So I have to move. This is awful. This is going to ruin everything I set up in my life. My life is over. That would be magnification. Minimization would be if you accomplish something great. You know, you got your first A on a test and you're like, oh, but I have so many other tests to take. I'm probably going to fail them. Catastrophizing. You believe that what has happened or will happen will be so awful that you're just never going to be able to manage it and you're going to fall apart. My boyfriend didn't call me back. He must be breaking up with me. I am never going to be happy. And then finally, personalization, attributing way too much blame to yourself for negative things that happen. Okay, I am totally worthless and will never become a licensed therapist, for example. Okay. So I have some examples here. Name the cognitive distortion. So if I'm not perfect, I have failed. My life won't get better. I cannot handle anything in my life, and I'm going to fail this class. So I'm going to give you a minute to try to think about which cognitive distortion each of these is. Okay. So I am not perfect. I have failed is dichotomous thinking. Because you haven't achieved perfection, you are then a failure. Right? Black and white thinking, no in between. You have to be perfect or you are a failure. my life won't get better is fortune telling here. It's that really negative view of the future. I cannot handle anything in my life, overgeneralization. So if something bad happened and now you just are destined to have more bad things happen, you're never going to be successful. You're overgeneralizing one thing, one belief to everything. And then I'm going to fail this class, catastrophizing, seeing the future negatively. So to reiterate it one more time, the cognitive behavioral model suggests that something happens, there's an event, you have thoughts about what happened, you then experience emotions based on your thoughts, and you respond to your thoughts and your feelings with behaviors. This cycle can start at any point, but with CBT, we tend to focus on and start with the thoughts, so changing perceptions, and expect that to trickle down into changes in the behaviors and the emotions. Okay, and notice there are double-headed arrows on each of these, again illustrating that everything influences everything else. Emotions influence thoughts and behaviors, behaviors influence emotions and thoughts, thoughts influence emotions and behaviors, and it just goes round and round. With CBT, we choose to focus on the thoughts first. With behavioral therapy, you can imagine, they choose to focus on the behaviors first. So that's the end of this particular video. We'll pick up with the next one by going through the CBT therapeutic process. Let me know if you've got any questions. Thanks.